I think as healthcare providers, we have two jobs, one of which involves healing the sick and bringing them back to health, but the other involves prevention so that accidents don't happen. And we know that after babies go home and they're healthy, the number one way that babies die in this country from 1 month to 1 year of age is SIDS and sleep-related deaths. But 4,500 babies die suddenly and unexpectedly every year in this country. And we like to think that we have the best healthcare system in the world, but when you look at those numbers compared to other countries, we're not doing as well as we should be in terms of infant mortality and the number of babies dying. Because this is truly an epidemic, but it's a silent epidemic and people just don't know about it. Because you're seeing deaths in little pockets and they're not all accumulated together, people don't recognize just how many babies are actually dying. But what we've learned over the year through our research is that many of the deaths that we thought were SIDS turn out to be accidental suffocation deaths. Cribs for Kids is a charitable organization whose mission is to reduce sleep-related deaths in infancy. And there are two mechanisms that the program works to do that. One is by providing education, not just at the family level, but also for healthcare providers and the community as a whole. And then for those families who are in need, we make sure they have all the elements of putting a safe sleep environment together in their home. So we provide a pack and play, a sheet for the pack and play, and a sleep sack so the baby does not have to be wrapped in blankets, which can become a risk factor for suffocation. The meat of the program is to provide education across the board, not just for the highest families that are at risk, but for all new families and the community as a whole. So after the first national conference that took place in 2008, we took back all the best ideas from what all the other programs were doing and said we need to make a comprehensive program so that we have comprehensive education for our community that would be hospital-based, but we would spread it out into prenatal care as well as into the pediatricians and family doctors' offices, the emergency department, as well as places that were teaching babysitters how to do cares in the home, the daycare centers. We wanted universal education. And now every family that delivers at any hospital in this area gets safe sleep education before they take their baby home. Since the program has started, we have helped over 2,000 families providing a safe sleep environment. Everybody who works in this program, we have about 20 people working in the program, are all volunteers. Most of them work at the hospital and just have a commitment to seeing infants be healthy in our community. So almost all the money goes to the pack and play sheets and the safe sleep sacks. A small amount of the money goes towards our educational materials that we develop. When I saw a program that for as little as $50 per baby, you had the possibility of saving a life, I thought that was a really great return on time and investment. By committing to this program, you're committing to quality of life. You're committing to safety to the most fragile people who live in our community. You are committing to making sure that we do everything we can in our communities to reduce the risk of infant sleep-related deaths, because no family should have to go through the tragedy of having their baby die because they couldn't afford to have a safe place for their baby to sleep, or they just didn't know the basic facts that they needed to know to keep that baby as safe as possible. And we can do something to reduce these tragedies in our community. So by supporting the Cribs for Kids program, and all the money that we obtain here stays locally right here in York and Adams counties, by supporting this program, you're doing something that has an immediate impact on the health and vitality and safety of our community.